hereby, in terms of Section 84.2, read that Section 79.1 of the Constitution of the Republic of South Africa, 1996, are sent to the National Health Insurance Act of 2023, Act number 20, and sign the English text thereof, given under my hand at Pretoria on this day, 2024. So I'll sign by the President. We are gathered here today to bear witness to the signing into law of the National Health Insurance Bill, which at the stroke of the pen is about to become an act of parliament. By putting in place a system that ensures equal access to health care, regardless of a person's social and economic standing and circumstances, the NHI takes a bold step and a stride towards a society where no individual must bear an untenable financial burden while seeking medical attention. And let it be clear that universal health care is a global initiative in many ways, where a number of countries are moving towards universal health care, and we as a country have made a global commitment that we are going to have universal health care. So those who are trying to hold us back to a fragmented system are completely out of line with the global vision that has been set, which we are a part of.
We must remain with commitment to timelines. And so the bill speaks of two phases with timelines, which says the first phase is from 2023 to 2026. And that first phase is to deal with the establishment of the institution, accelerating, strengthening of the health platform, and all other basic instruments, which we have not gone into a lot of details. So within the middle of 2026, then 26, 27 up to 28, we now, in terms of the act, it commits us, although some element of actual programs should be starting even in the first phase. But when it comes to the second phase, it must be more intensive conclusion of actual implementation programs in terms of contracting of services. Of course, in the public sector, it's much more easier to accredit and be able to include those which, there are a number of public health facilities which even tomorrow, especially at the primary health level and even at some of the district services, which even, as early as tomorrow would qualify in terms of the Office of Health Standards and Compliance, which is doing these assessments.